Kidney stones are a health issue far more prevalent than commonly perceived, affecting a significant portion of the population throughout their lives. This condition can manifest in individuals of diverse ages, genders, and lifestyles, with intense discomfort and pain being among the most formidable challenges faced by those afflicted. Dr. Samira Roze, a seasoned urologist, has dedicated her career to comprehending and treating renal diseases. Here, she aims to elucidate the most frequently asked questions regarding kidney stones, providing insights into their prevention and, crucially, how to identify the early warning signs that can be paramount in ensuring optimal health outcomes. Firstly, it is crucial to understand what kidney stones are. They are hard crystals, or deposits formed from minerals and salts that accumulate in the kidneys and can vary in size. Depending on their size and location, these calculi can move, causing excruciating pain, particularly when they travel through the ureters, the tubes connecting the kidneys to the bladder. This movement can lead to a sharp, often agonizing pain, frequently compelling patients to seek emergency medical attention. But the paramount question is, how can you discern if an intense pain is imminent and what can be done to avert it? This is the crux we will delve into in this video. It is imperative that everyone be cognizant of the warning signs that may indicate the formation of kidney stones, and most importantly, how we can forestall the pain before it escalates to an unbearable level. There are several signs that may indicate you are developing kidney stones. Often, these signs can be subtle and go unnoticed, but recognizing a few of them allows you to take swift action to prevent a painful crisis. Let's explore the 6 primary signals you should be mindful of. 1. Back or flank pain. Persistent pain in your back or side, particularly in the lower region, can be an early indicator of a kidney stone formation. The pain may initially be mild, but it can intensify over time. This occurs because the stone may be moving or putting pressure on the surrounding tissues, thereby generating the sensation of pain. 2. Presence of blood in urine. Another significant indicator is the presence of blood in the urine, which may be visible to the naked eye, giving the urine a pink or reddish hue. When this occurs, it signifies that the stone could be causing abrasions on the walls of the ureters or kidneys, leading to bleeding. This is a distinct sign that something is amiss and warrants immediate attention from a healthcare professional. 3. Cloudy or dark urine. In addition to blood, if you notice that your urine is cloudy, dark, or has a strong, unusual odor, this could indicate a kidney obstruction or even a urinary tract infection associated with a kidney stone. This type of change can occur when stones block the flow of urine, leading to an infection that requires urgent treatment. 4. Increased urinary frequency. If you find yourself urinating more often than usual and notice that the volume of urine is notably reduced, it could indicate that kidney stones are starting to obstruct your urinary tract. This symptom can be uncomfortable as, despite feelings of urgency, it may be impossible to fully empty your bladder. Such a condition warrants prompt investigation by a medical professional. Kidney pain can also manifest as nausea and even vomiting. This symptom arises from the nervous system's attempt to cope with the intense pain, triggering such physiological responses. Moreover, kidney stones can exert a direct impact on the digestive system, inducing this type of reaction. 6. Severe and sharp pain. Finally, the most evident sign that you might have a kidney stone is severe and sharp pain. It typically manifests in the lower back or flank and can be so intense that the individual is unable to move. This pain can come on suddenly and is often so debilitating that it necessitates immediate medical attention. Now that you're familiar with the warning signs of kidney stones, I'd like to ask, have you ever experienced anything similar? Or perhaps you know someone who has endured this pain. Please share your story in the comments. Your experience could be invaluable to many individuals currently going through this and unsure of how to proceed. But before we go on, may I ask you a small favor? If you're learning something new here, why not give that like a boost and subscribe to the channel? That way, you'll receive more incredible content about health and prevention. and you'll be in the loop about all the ways to enhance your quality of life. Let's embark on this journey of care and well-being together. Now that you are familiar with the signs and symptoms, the next step is to understand how to prevent kidney stones from forming or to mitigate the intensity of the pain. Prevention is always the optimal course of action to avoid more serious complications. It is futile to wait for the pain to manifest before seeking treatment. The paramount concern is to adopt healthy habits to care for your kidneys from the outset. One of the simplest ways to prevent kidney stones is to drink plenty of water. Staying hydrated is crucial for ensuring proper renal function and preventing the formation of crystals and stones. The recommendation is to consume at least 2 liters of water daily. This will help dilute the substances present in your urine and inhibit the development of kidney stones. Moreover, adopting a balanced diet, abundant in fruits, vegetables, and fiber, is crucial. Abstain from excessive consumption of foods high in salt and animal proteins, as these can burden the kidneys and contribute to an elevation in mineral concentrations, thereby facilitating the formation of kidney stones. Remember that calcium intake should also be carefully monitored, as both deficiency and excess can be detrimental to renal health. Another crucial aspect is the consistent practice of physical exercise. Sedentary behavior is directly linked to the development of numerous diseases, including renal problems. Physical activity contributes to overall body health by aiding in the elimination of toxins and regulating blood pressure, a key factor in preventing kidney issues. Finally, it's always wise to remember that regular checkups with your physician can help identify any health issues before they escalate. Periodic consultations with a specialist can be paramount in maintaining renal health and forestalling future complications. Throughout this video, you've learned about the most crucial signs of kidney stones, ways to prevent this issue, and how to effectively care for your renal health. Now, we'd love to hear from you. Have you ever experienced kidney stones? Or do you have any prevention tips you'd like to share with our community? If you enjoyed this video, please remember to subscribe to the channel and turn on the notification bell to receive more content like this, always with practical tips and valuable information about health. Here, we care about your well-being, and together we can build a community of people who take better care of themselves. Your interaction is incredibly valuable to us. Please leave a comment and share with us what you learned from this video. Who knows, you might help someone better understand their kidney health. Let's exchange insights. Thank you for watching until the end. If you have any questions or want to learn more about this and other health-related topics, stay tuned. Let's continue learning and taking care of our bodies together. See you in the next video.